Good morning. Guess who's sick? Me. I'm sick. But luckily, I'm an internal medicine doctor and we're going to tackle this head on, and I want to go over the counter medications with you guys today so that we can all have a much better sick season. All right, so when it comes to runny nose, nasal congestion, these are my top picks. These two are the same thing. This is just the generic version. Oxymetazoline is going to help with constricting the blood vessels in your nose to stop it from running. Very effective, very powerful, and sometimes for me, like if my nose is really running, I will use this, but I'll have to follow it up with a saline spray just to moisten up my nose, so it's not so dry and like uncomfortable. If my nose is not running too bad, I will use Flonase. This is an intranasal steroid. Steroids are anti-inflammatory, so it's also going to help with decreasing that mucus and drainage from your nose. So with this, make sure it's spraying, and you're going to want to ankle it up and up towards the sinuses, and you want to get this thing all the way up in your nose. You don't want to sniff it because then it can go into the back of your throat, and that's not where we need it. We need it to stay in there. So if you get a hole in your nose for a little bit, whatever have you, but don't sniff like I just did, which I'm sniffing because my nose is running. Anyways, this is loratadine. This is the generic of Claritin. It is non-drowsy. You can take this once a day, and it is also going to help with congestion. And it's more systemic because you're taking it as a pill, so it's going to go throughout the body and help with congestion all over, which is great. I want to take this morning. It's empty. So guess who's going to have to go to CVS? That would be me. But I really like taking this. I started feeling an itch in my throat yesterday. And so I took this, and then I love this stuff, okay? This is guaifenesin. You might know it by the generic name of, the trade name of Mucinex. It helps with thinning your mucus, and then the dextromethorphan helps with suppressing your cough. You do not have to take the dextromethorphan. It's kind of like a synthetic opioid, which is why this is also monitored in the store because people use this to make bad things in styrofoam cups.